So primary health care is basically the first point of contact that patients have with a healthcare system. So this can basically be a community clinic, it could be a pharmacy, but more importantly for us as Dunia Health, our focus is mainly on pharmacies as the primary healthcare facility. Because from our research, it has shown that most patients, especially in Africa, and we saw this more so during the time of COVID, that most people depend on local pharmacies or retail pharmacies as their first point of contact with the healthcare system. So what we usually get to see is that when patients have got different symptoms, they usually go to the retail pharmacies and say, okay, this is how I'm feeling, could you prescribe some form of medication to me? And that's a cardinal part of the healthcare system itself, although there's very little focus around that. And our emphasis is we need to begin to move from the pharmacies being product-centered to them being patient-focused. Can they give a bit more of a holistic healthcare service to the patients? So that's why that is important. Supply chain is, pretty much the heart of it, because it determines the access to primary health care, right? All of it is a logistics system. And for us, there are three cardinal things about the problem of supply chain as far as primary health care is concerned. The first one is access, right? Availability. Are products available? Is primary health care available for most of the patients in Africa? So that has to do with the service itself, but the medicines as well. The second part is affordability. Is primary health care affordable? Because that affects accessibility in itself. So are the patients able to afford primary health care, whether it's a service or it's the products themselves? Then the other part is about the quality of the service that's being delivered, right? So delivery integrity. Is there quality that is being delivered at the primary level as the first point of contact with the healthcare system? So that is why that is very important. I strongly believe that the strength of any healthcare system is largely dependent on primary health care. If we are going to assure primary and universal health care to everybody, we need to give capacity and strengthen private pharmacies that are operating as primary healthcare facilities. This is absolutely important, and it is important that the policymakers and other private and civil society organizations come on board so that we begin to rethink, reimagine, and reshape primary healthcare for all, especially in Africa. Thank you.